Have you ever wondered if living with an autoimmune disease can cause you to develop cancers? Are there any specific autoimmune diseases that will increase your risk? And what about the medications that we use to treat autoimmune diseases? Do they increase your risk for cancers? These are not hypothetical questions. These are real questions that I hear from my patients in my clinic, Rheumatologist on Call. Today, not only that I will help you to understand if there is a connection between autoimmune diseases and cancer, but I will leave you with some practical tips to protect yourself. I'm Dr. Girnita, a rheumatologist with more than 15 years of clinical experience in treating patients with arthritis and autoimmune diseases. So I know how overwhelming these conditions can be, especially when we talk about new risk like cancer, when we talk about adding this to the mix of an autoimmune disease. So my goal today is not to scare you, but to empower you. Because the more you know, the better you will be prepared to take action if something doesn't feel right. So let's start by answering the big question. Can autoimmune diseases increase the risk of developing cancer? Unfortunately, the answer is yes. The connection is not a coincidence. It's actually rooted in how our immune system works. Autoimmune diseases are fueled by chronic inflammation, which is a process that can quietly cause damage over time. Think of inflammation like a fire. When it's short-lived, it helps fight infections and repair injuries. But when it becomes chronic, the fire doesn't go out. It keeps burning, damaging tissues, weakening your body's ability to repair, and increasing the chance of cellular mutations. And those cellular mutations are the first step towards cancer. But that's not all. In autoimmune diseases, the immune system is already out of balance. It attacks healthy tissues, and sometimes it fails to recognize and destroy the cancer cells. Now, on top of that, add the fact that certain immunosuppressive drugs, which lower your body defense mechanism, they will also participate into this process. And what you've got is what I call the perfect storm. So if autoimmune diseases increase cancer risk, the next logical question is, what kind of cancers are we talking about? What are the most common cancers in people with autoimmune diseases? Now, certain autoimmune diseases are linked with specific types of cancers. And let me give you some examples. Lymphomas, like non-Hodgkin or Hodgkin lymphomas, are frequently seen in patients with lupus, Sjogren syndrome, or even rheumatoid arthritis. But what are lymphomas? They are a type of blood cancer that can cause painless swelling of the lymph nodes in the neck, under your axilla, or in the groin, but they can also cause fatigue, fever, night sweats, and unexplained weight loss. Another type of cancer was lung cancer, which is seen more frequently in patients with systemic sclerosis, which is an autoimmune disease that can cause scarring of the lungs. We will discuss a little bit later about this in the video. And then bladder cancer. That was seen more in patients that they take certain medications like cyclophosphamide, which is a medication that is usually used in people with vasculitis or lupus that affects the kidneys. And also skin cancers like melanoma or non-melanoma. They were seen more in patients with autoimmune diseases, but they are also seen in patients treated with certain drugs like TNF-alpha inhibitors such as adalimumab or Humira or etanercept or Enbrel. But now let's go even deeper. Which autoimmune diseases carry the highest cancer risk and why? As a rheumatologist, I'm particularly interested in educating my patients with certain autoimmune diseases about their increased risk to develop cancer. And as I mentioned in the beginning of this video, my intention is not to scare my patients, but rather to educate them to be aware and report their symptoms immediately to me. First, let's talk about dermatomyositis. This autoimmune disease can affect the skin and the muscles in a specific pattern. The skin is affected by rashes around the eyes, around the hands, even rashes over the thighs, while the muscles, especially the proximal muscles in the arms and in the legs, they can become very weak. Another form, polymyositis, affects just the muscles but not the skin. Unfortunately, research shows that about 20% of patients with dermatomyositis develop cancer, especially in the first 5 years of the disease. That is why when I diagnose someone with dermatomyositis or polymyositis, I will make sure that they don't have any signs of cancer. But how do I do that? I will order a complete screening that is age appropriate, from a CT of the chest, abdomen, pelvis, to endoscopies to evaluate the GI tract, to pap smears, and even a PSA level, and I will order a prostate exam if the patient is a man. My recommendations is to have this kind of evaluation every year for about 5 years after a diagnosis of dermatomyositis and polymyositis is made, because dermatomyositis was associated with ovarian, with lung, with pancreatic and stomach cancers, and it appeared in certain cases as the first sign of cancer before the people were even aware that they have this problem. At the same time, polymyositis carries a slightly lower risk, but it was also associated with lung and bladder cancer, and sometimes with non-Hodgkin lymphoma. There is a specific category of people with dermatomyositis or polymyositis that they have an increased risk, and they are patients with a certain type of antibodies, like this one, TIF1 gamma or NXP2. So, if you carry these antibodies, then pay close attention to your symptoms. Now let's talk about patients with lupus. This is an autoimmune disease that can affect the skin, but also multiple inner organs, and it can cause chest pain, kidney issues, hair loss, joint pain, and many other symptoms. And patients with lupus, we know that they have an increased risk for cancer. Now let's look at this study from 2009. It showed something striking. Patients with lupus were 4 times more likely to develop a non-Hodgkin lymphoma compared to the normal population, but also other types of cancer like vulva, lung, thyroid, and liver cancers. Plus, if you have a chronic infection with EBV virus, and if you develop lupus, which is a common situation, then be aware that you may develop a type of lymphoma. And very interestingly, patients with lupus have a lower risk to breast cancer or prostate cancer compared to general population. Why? I don't think we know why. Now, let's move on to patients with Sjogren's disease. Sjogren's disease is an autoimmune disease known to cause dryness of the eyes and mouth because it can affect the lacrimal and the salivary glands. But there is so much more than that. A Sjogren disease can affect the joints, the lungs, the GI system. And if you watch my YouTube channel, then you have there many videos about this disease and about how to manage it, so check them out. In 2014, a study that looked at 14,000 patients found out that patients with Sjogren disease had also an increased risk to develop non-Hodgkin lymphoma and thyroid cancers. Another study in 2024 from France found out that certain patients with a higher disease activity, with more systemic symptoms, and not only the dry eyes and dry mouth are the ones that have a higher risk. But not all patients with Sjogren carry the same risk. But how about patients with rheumatoid arthritis? Are they at risk to develop cancers? There is a lot of controversy regarding this. A study from 2015 in patients with rheumatoid arthritis found out that they are at a slight increased risk to develop lymphoma and lung cancers. But then, when using treatments like DMARDs, this risk was not increased. And this is very important, especially for those patients who have a history of cancer. Many patients with a history of cancer, they fear that taking medications that will suppress their immune system will cause the recurrence of the cancer. But the science says that DMARDs will not increase the risk of that cancer to come back. And even our latest guidelines from 2021, they say that for patients with a history of melanoma or non-melanoma skin cancers like basal cell or squamous cell carcinoma, DMARDs are safe. Now, how about biologics? These are stronger immunosuppressive drugs that we use for people with rheumatoid arthritis. Can biologics be used in people with non-melanoma skin cancers? The answer is yes, but it is necessary to have regular annual skin checkups with your dermatologist, the skin doctor. But this is very important. In patients with melanoma, biologics and JAK inhibitors are not indicated. In patients with a history of melanoma and lymphoma, in them we recommend to use DMARDs and rituximab, with rituximab being actually the preferred drug, especially in people that have a history of lymphoma. And now I want to mention two other diseases that are linked with cancers and are quite common seen in my practice. But first, let me tell you a story. John was a 70-year-old gentleman that came to me because in 1 week he developed so much pain in his shoulders and neck that he was barely able to raise his arms. He was unable to dress himself and he was in a lot of pain. The next week he noticed that he started to have pain in his thighs and he had difficulties to get out of the bed. He had fevers and he felt very sick. He called his primary care physician and luckily he was seen that week. Now his doctors gave him some ibuprofen and sent him home. But in another week, John was so sick that he could not get out of the bed, and his wife called desperately the doctor, who ordered more labs, and he referred him to a rheumatologist. His wife called all the rheumatologists in the area where they live, and no one could see John for 6 months. Then one of John's best friends recommended to look for a rheumatologist online, and that's how he found me. When I listened to his story and looked at his recent labs, I knew he was dealing with a type of inflammatory arthritis that we usually know that is affecting people over 50, and this is called polymyalgia rheumatica. After I started him on the treatment, in just a few days he called me that the treatment has been miraculous for him. He was back to his normal in just 1 week. But I remain quite concerned because I saw something in his labs, something that remained abnormal. And he also told me about some symptoms that were not quite part of the PMNR or polymyalgia rheumatica picture. So with my detective approach, I sent him for more tests and a colonoscopy. He called me in 1 month and he said, "Doc, you saved my life. The gastroenterology found a cancer in my colon and they just removed it. Thank you." I was so happy for John because, as you can see, in his case, the polymyalgia rheumatica was the way that the cancer presented. We call this phenomenon paraneoplastic syndrome, and that's why when I diagnose a patient with PMNR, I also order other appropriate cancer screening tests for my patients. Last, let's talk about people with systemic sclerosis. We also call this scleroderma. This is an autoimmune disease that can cause progressive thickening of the skin and the inner organs, which can lead to many complications from skin damage to lung and heart fibrosis and even to more severe GI changes. In 2014, a study in 2,000 patients with scleroderma showed that they have an increased risk for breast and other gynecological cancers, gastrointestinal cancers, especially if they carry a specific type of antibody that we call RNA polymerase III. There are also other studies in patients with systemic sclerosis that had interstitial lung disease, which is the fibrosis of the lungs, that found out an increased risk for lung, liver, and bladder cancers. And that is why I recommend to monitor for lung cancers if you have lung fibrosis and systemic sclerosis. And now that you have learned what types of cancers are associated with certain autoimmune diseases, the next big question is related to what anti-rheumatic drugs can increase the risk of cancer.